Okay, so now we're thinking about why do women fall pregnant? And inevitably, always the first um, thing that students will put down under the voluntary column is to start a family. And then there'll be a discussion. And in fact, it was one group of students a few years back who made me understand myself that that actually doesn't belong in the voluntary column. Because, as we've said already, in terms of why do women have sex, starting a family or having a baby is not always entirely voluntarily that woman's choice. There is a huge amount of societal pressure, relative pressure, partner pressure. And I mean, I'm not saying, of course, there are women who decide that they want to have a baby and then they have a baby, sure, fully like in all control of their reproductive health. But there's a huge amount of again, disempowerment in this country in particular, globally, but we're talking about South Africa. Disempowerment, cultural expectations, societal pressure. I remember when I got married, I had not even had my first sip of my pink champagne when my mother-in-law was already asking me, when am I going to have a grandchild? And I made her wait 10 years because I have that kind of agency. Not everybody has got that kind of agency. So in fact, this has to be bumped into gray area because not every woman, even though she voluntarily does it and maybe she just kind of agrees, even though maybe she'd rather do it later for the sake of her career, or maybe she doesn't want another child because she's already got 3 or whatever, but it's often not a fully voluntary decision. Then students will put surrogacy down. Now, I sort of look at this in 2 ways. If you're going to be a surrogate for, let's say, your sister, okay, that's more understandable. If you're going to be a surrogate for someone that you don't know, well, what's in it for you? Firstly, is it legal to be paid to be a surrogate in South Africa? I don't know if you know the answer to that. The answer is no. But does that mean that money does not exchange hands? Again, the answer is no. So I would say that possibly surrogacy in some circumstances certainly is driven by an economic need rather than an altruistic desire. And we know that the number one cause of death of young women of reproductive age is pregnancy. So why would you want to put yourself through that for someone else? So we can debate it, but we often end up deciding that surrogacy might be not necessarily just be born out of an entirely voluntary desire, but out of a need to get something out of that exchange. So we often end up moving it to a gray area. So I'm not making absolutes here. We can't apply what we're saying to everybody, but we're just interrogating things a bit more. Then students will often put to keep a man. So what do you think the first thing will happen is when this man finds out that the woman is pregnant? Probably first bus back to Joburg or whatever. I can tell you that if you are trying to have a baby to save a flailing relationship, having a baby is one of the most stressful things that has ever happened to me. Joyous, wonderful, fantastic. But the antenatal sister, when we went to antenatal classes, said to me and my husband, you better learn how to argue decently and properly now, because you're not going to argue ever. You will never have argued as much as you will when you're both sleep deprived and the baby's got colic, etc., etc. And she was entirely right. So in some cases, obviously, it could keep the man. But the point is, why would you want to do that? Okay, maybe you're passionately in love with this person and you think this will fix it. But equally, again, we come back to the socioeconomic paradigm. Maybe you're desperate to keep that person because he is your sole source of income. So again, because maybe if you had other options or you had your own steady income or job or whatever, maybe you wouldn't be thinking about doing something like that. So we end up deciding that it's probably better in a grey area because of the societal issues behind it, not because of the actual act of falling pregnant. Then we've got to get a childcare grant. Now, this is highly controversial in terms of the research. Some research says that it doesn't happen. How insulting. Some research says it does happen. What I always ask students is, how much is a childcare grant? And there's sort of some murmuring. And then I tell them that it's about 400 Rand. And how far can you get with a baby and 400 Rand? Not very far. It doesn't cover clothes or nappies, or, I mean, a tin of formula, if you're going to formula feed, is about 200 Rand for 2 weeks. Babies are freaking expensive, guys. So that childcare grant, some of the literature says that it is born out of poverty because it is at least a source of income. But again, if you had, I mean, it's 400 Rand. So clearly, if you are having a baby for 400 Rand, if you had other options, you would probably be headed down those other options. So again, after discussion, we normally move this into a grey area, because if there were other decisions or other options, you probably take that other option. Okay, so now we've kind of got nothing involuntary, which is a bit awkward, but I mean, because obviously there are definitely women who do want to have children in and of their own right. My husband's cousin never wanted children. She turned 40 and she was like, crap, I just turned 40. And she went to a sperm bank and she got a donor and she had her baby on her own. She wasn't in a relationship. So she was fully in control of that. So I'm not saying that this is really truly empty, but we're keeping in mind the societal pressures that women face here. Okay, then on the involuntary column, obviously rape. Well, women fall pregnant for all the same reasons that they have sex, right? Obviously. But students will write rape here. And then sometimes they will put under involuntary, that cultural and societal pressure that I keep talking about. And I don't think that that's entirely involuntary. I think it depends on how much agency you have. So the example for myself, I was able to keep all those expectations at bay. Other women might not be able to do that. So I think it depends. And the minute we say that it depends, then it's more of a grey area issue because it's not absolute. So I'm going to move that into the grey area. And then we are going to talk about what most groups, not all, most groups will put down failed contraception either under involuntary or grey area. And then I take out my little pink soapbox and I get on it because you know by now how passionate I am about contraception. And so we're going to have a little conversation, which you probably know all this already because you've had such brilliant teaching on the online forum. But in real life, students often struggle to come to the answers to a lot of these questions. So I'm just going to give you a little sound effect of what you would normally hear when I start asking the question. So firstly, we discuss the fact that every single contraceptive method has an inherent failure rate. So that's just your baseline. You can be as responsible as you like and you can still fall pregnant. Okay, then we talk about the pill. Why does the pill fail? And the first answer I'll get is because she forgets to take it. And then I'll say, but isn't there a mechanism to deal with that? How do you deal with a missed pill? And then I hear this. Crickets. Because people don't know. It's okay not to know. It's just okay to know that you have to look it up before you have to explain it to a patient. Then I ask students, have you ever seen anyone prescribing the pill to someone explain to them what to do in the event that they miss a pill? And everybody will shake their head. They've seen people give the pill, but they've never heard them explain that to a woman. And then I'll say, well, okay, maybe it's just irresponsible of that woman to miss the pill. And then a lot of people will get cross, and I'm very glad when they get cross, because of course, what if your baby gets burned and you have to go to Red Cross hospital and you have to stay there for 5 days? You didn't bring your pill with you. I mean, life happens, and it doesn't even have to be that dramatic. You can just be like a normal human being and forget. So we don't tell people how to deal with missed pills. And then I say, well, how else does the pill not work? Crickets. Eventually we get to the fact that in order for the pill to work, it has to be taken at the right time. It has to be absorbed. So what affects absorption? Vomiting, diarrhea. And then I'll ask the class, okay, well, who gets vomiting and diarrhea? And they'll say, pregnant woman, vomit. And I'll go, everyone gets diarrhea and vomiting at some point in their lives. Have you ever heard anyone prescribing the pill explain that to a patient? And everyone will say no. And then I'll say, okay, how else does the pill not work? Even more crickets. And eventually we will get to drug interactions. And then I'll say, yes, good. Which is one of the most potent enzyme inducers that we use all the time in this country? And then there'll be more crickets. And then eventually I'll drag out of someone rifampicin. And I will say to the class, have you ever heard someone prescribing rifampicin to a woman, ask her what kind of contraception she's on? And every single head will go, no. So now that woman falls pregnant because of something that we did, and whose problem is it? It's not our problem. Okay, so that's the pill. Then we move on to the injectable, and I say, how does the injectable not work? And I'm busy picking on little souls in the class, and someone will venture it wasn't administered properly. Well, no, it's very difficult to screw up giving the injection. It's not that. And then there'll be a lot of silence, and I'll say, okay, you guys remember being in 4th year in labor ward, right? The baby comes out, the placenta comes out, the pitocin goes in, and what's the next thing that happens? 2 months or 3 months, bam, and the woman is given an injection. Is there any discussion about side effects, options, anything? Anything? Did you see any contraceptive counseling? Probably not. Horrendous. And then that woman goes away and she gets horrible side effects. So what kinds of horrible side effects are there? Heavy irregular bleeding, and you might think you're dying if that happens to you and your period was always regular and no one explained it to you. Weight gain. And weight gain is not just vanity. I've had a patient say to me, doctor, I cannot afford to buy new clothes. So a real socioeconomic issue. Then you have the amenorrhea. Now, what do women think when they become amenorrheic? And I think if you've done your quiz, you will remember that one of the main concerns about amenorrhea, students always say that a woman will think she's pregnant. Well, yes, but that you can check for, and it's actually not the biggest concern about amenorrhea. The biggest concern is about being infertile because of the value that society places on fertility. So amenorrhea freaks women out, or they think that all that blood is building up in there and they're going to get very sick. So those are the myths that we covered in your quiz, and they're very real. And then you don't tell someone that and it happens to them, they will lose faith in the method and they will stop. So side effects are a major problem because patients don't come back, or if they do report, they're just simply ignored. Okay, don't be that person. All right, then we move on to condoms. So why do condoms fail? And then everybody will say, because they're not used properly. And then I'll say, but what do you mean by that? And then there'll be more crickets. And maybe another brave soul will say, it burst. And I'll say, well, why did it burst? And then there'll be a deafening silence. And what I'm getting to is the fact that if you use the wrong lubrication, so if you use Vaseline, you're going to dissolve your condom. If you don't eject the air out of the tip, it could rupture. So then I ask, have you seen anyone who's dishing out condoms like Smarty Packets? Have you seen them explain how to use and how not to use a condom? And everyone shakes their head because they haven't seen that. It's never explained. Is it on the condom packaging, how to do it, what not to do? No. Is it on Durex? Yes. If you buy it from Clicks, sure. But government issue? Nothing. Nothing. So, that's a bit awkward. Okay. Now we think a bit more societally speaking. Why do condoms fail from a broader societal point of view? And then you can just see steam coming off people's heads because they're like, what the hell is she talking about? Well, can everybody negotiate with their partners to use condoms? And the answer is a resounding no. So condoms as a form of contraception in our society are fraught with difficulty because we talk to women about the fact that condoms need to be used. And okay, some women don't like using condoms. We're not going to throw all the shade at the men, but it's usually the male partners who don't want to comply with that request. So we don't counsel patients on how to use their methods properly, what to do, what not to do, when to use backup methods, all these different levels. And what about if you are 16 and you want to go and have the injectable and the nursing sister is your mother's neighbor? Super awkward. What are you going to do? So our attitudes, our lack of counseling, our lack of explanation leads to a lot of unplanned pregnancies. And we have to own up to that. We are a huge part of the problem. And I really would like you guys to not be that person. Okay, so I'm getting off my soapbox now, off the soapbox about contraception. So let's look at the gray area. Here we've got lack of access to contraception, yes, lack of education about how your period works and when you're fertile, etc. And then we moved all these other things here, starting a family, surrogacy, to keep a man, to get a government grant, and cultural and societal pressure. So again, you know, when we think of pregnancy, we always think, wow, happy people, everybody wants to fall pregnant because they want to fall pregnant. But actually, there's all this other stuff that is under the surface that is relevant to our country, where a lot of women don't have good control over their reproductive health. And even for women who do, things happen in life. Okay, so we're going to stop this video and go on to the next one, which is, why do women have TOPs?